we now operate at 5 and we get great effects.
Hey folks, it's Andrew from Gemba Red, and today we'll be talking about how clinical grade red light therapy doesn't sell. Now, you just heard a recent interview with Professor Glen Jeffery that he's down to 5 milliwatts per centimeter squared for a lot of his research that includes both on the body and in the eyes, and he's getting great results. And this number is not very shocking because it's also similar to what Dr. Hamlin has been saying for many years of recommending 10 to 20 milliwatts per centimeter squared for large LED panels, large devices, and even up to full body devices, just 10 to 20 milliwatts per centimeter squared.
So for instance, if you have what most people would think is a very low power density, let us say it's 10 milliwatts per square centimeter. You know, if you've got an LED array, which is only 10 or 20 milliwatts per square centimeter, there's probably no rational limit. So, you know, if you go in a whole body light bed and you're in there for 10 minutes, you will absorb 200,000 joules of optical energy.
And again, even Dr. Hamlin addresses that most people would think 10 milliwatts or 20 milliwatts would be very low, but in actuality, if you do the math on the total joules that you absorb, it can be quite high with any panels, especially he kind of describes any panels about 1 foot by 1 foot square or higher. So why aren't manufacturers making their devices 5 to 10, maybe up to 20 milliwatts per centimeter squared? Why aren't influencers that pretend to be unbiased and scientific always pushing to get the highest intensities to claim to be totally scientific? Because they know that the more intensity they can claim as scientific, the easier it is to sell the products.
I have said to some of the manufacturers, you know, turn the power down. And they say if you've got two devices next to one another, one very bright and one on the dim side, no one's going to buy the dim one. And okay, I kind of get that, but I am definitely 100% saying that most of the devices that are on the market are extremely poor quality, are potentially in the long run may do more harm than good.
So even Professor Jeffery even says he's directly talked to manufacturers, he's asked them to turn the power down, and they outright refuse. And we also know that Dr. Hamlin has also been a direct advisor to many brands, and he's also been an advisor to influencers, doing interviews, podcasts, and even co-authoring a book, when even that influencer that wrote the book had to embellish and push the intensity levels a little bit higher than what Dr. Hamlin has usually recommended of just being 10 to 20 milliwatts per centimeter squared. And from a manufacturer's perspective, it just doesn't make sense. Let's say my brand Gemba Red needs a full body panel, and another brand called Mitochondria needs a full body panel, so we both go to Shenzhen Idea Light on Alibaba to get our panel. Now, I would tell Shenzhen Idea Light to turn down the power so we can cap it at a level that's very safe and very effective, very mistake-proof on how you get good results without getting any side effects. And maybe Mitochondria will just say, hey, just max out the power as much as you can. We need it for marketing, and we don't really care about people's health and safety. But then when we break it down, it's the same size panel, same enclosure, same number of LEDs, same number of drivers, same number of fans. Everything's the same. So the cost to manufacture is essentially the same, and the cost of shipping is a big part of it too. That's going to be the same as well. So we really don't save any money on manufacturing when we intentionally turn down the power to make them clinical grade and make them extremely safe and beneficial in the long run. But when both panels get reviewed side by side and they do the value proposition, then the Mitochondria looks better. They end up selling more, so they get volume discounts, they get discounts on shipping. And so actually the high-powered devices end up being cheaper when the low-powered devices don't sell as much. They have more overhead costs that they have to deal with. And so the low-power devices end up costing more to produce and sell and run a business under. Now, another simple example is I found some 810 nanometer lasers from eBay. And under the same listing, you can select the variants of 100 milliwatts, 200 milliwatts, or 300 milliwatts. And the price only goes from about $25 to $30 to $32. So if you do your value proposition, then the 300 milliwatt one is twice the value, even though, the power doesn't really increase the cost that much. And even though we know 100 milliwatts per centimeter squared is a highly studied red light therapy power level for, low level laser therapy, and It's also been studied that 100 is superior often to higher powers because we want the right power level, we want the right intensity. It's not all about your joules per centimeter squared. And so if we know 100 milliwatts per centimeter squared gets you the best therapeutic response, then that's what we would do, and we wouldn't worry about the, supposed value of how many milliwatts per dollar you get. That's absurd. So we want to get the best value is the one that gets you the best benefits, safest in the long run.
So they're producing far too much energy. People originally were operating around 100 milliwatts, 80 milliwatts per centimeter squared, which is bright. It's really uncomfortable. They came down to 40. We now operate at 5. And we get great effects.
And so if you listen to the chronology from Professor Jeffery, they started out relatively higher with higher intensities of 100 milliwatts per centimeter squared down to 40, now down to 5. And that's kind of the lineage that happens with a lot of medical devices, with a lot of drugs. They end up starting at relatively higher doses because they're unsure about the efficacy. They want to make sure it beats out a placebo effect. And so they start out relatively higher. And then in the long run, as the drug develops, as it matures, as they gain confidence in the efficacy, they can reduce those doses. And so that's the same path that red light therapy has been following. It started out relatively higher intensities, higher doses, and again, maybe that's just because of a artifact from lasers, but now we can use much lower intensities, LED devices, much safer and better in the long run. And a lot of people have gotten the wrong impression that they think that technology like LEDs and lasers will get more powerful over time and get cheaper, kind of like a Moore's Law kind of thing. So they just assumed we were limited by technology in the past, and that's what kept people using low intensities in the past. And maybe in the future we'll see a lot more studies with high intensity. And listen, that'd be great. I'd love to see more studies with high intensity, but there's a reason why they intentionally used low power and low intensity. It was not because of a technology limitation. Remember, the branding of low-level laser therapy and cold laser therapy, that actually existed because it needed to help people identify the low-powered lasers that don't cause heat from the high-powered lasers that already existed. So high-powered lasers have always existed ever since the 1960s, and so they chose to use low powers for the therapeutic effects. And again, this cope is coming from people ignoring that these modern studies in the past 2 years have chosen to use intensities like 9 milliwatts per centimeter squared, 3 milliwatts per centimeter squared. And so obviously they had access to high intensity panels to do those clinical studies, but they chose to use lower intensities purposely. So it was not a technology limitation, especially when you're trying to cope with modern studies that are coming out within the past 1 or 2 years.
If you put too much energy into the system, it just doesn't work very well. And what we think is happening is we're starting to push so many electrons down the electron transport chain that you're starting to get backup. They're starting to get, and the consequence of that is the production of reactive oxygen species, which drives inflammation. So what you might be doing is you might actually be making the whole system worse. Reactive oxygen species are associated with premature aging. You might actually think you look actually slightly better because a small amount of inflammation will also iron out some of the wrinkles on your face, a bit like a Botox injection. And so you may think that's actually okay. In the long run, I want to see where we are with people in 10 years' time with people that have used masks.
Now, I have had a similar morbid curiosity of what's going to happen to a lot of these people using excessively powerful devices. A lot of influencers are still pushing the most powerful LED masks that they can find, the most powerful LED panels they can find, even for skincare. And like Professor Jeffery said, we kind of have a morbid curiosity of what this human experimentation will lead to. So we hope nothing bad will happen to people, but we also don't want to give up that citizen science, that anecdotal data of what's happening to people that use excessive intensities for long periods of time.
If you've got an LED array, which is only 10 or 20 milliwatts per square centimeter, there's probably no rational limit. So, if you go in a whole body light bed and you're in there for 10 minutes, you will absorb 200,000 joules of optical energy.
And if you go back to the beginning of this video, what Dr. Hamlin was saying, that if you just follow 10 to 20 milliwatts per centimeter squared, there's really no logical limit. There's no way you can overheat yourself. There's no way you can run into biphasic dose response issues. There's no way you could really get adverse reactions unless you're hypersensitive. So it's extremely safe. So you don't need to worry about it when you actually listen to the clinical researchers like Dr. Hamlin and Professor Jeffery when they're recommending 5 to 10 to 20 milliwatts per centimeter squared. That's the inherent safety of low-level light therapy, of photobiomodulation. And so again, you see the theme and the contrast that the real clinical researchers like Professor Jeffery and Dr. Hamlin have always been recommending relatively low intensities, low powers, low energies, or total joules if you want to quantify it that way. Then those are the real experts that you should be listening to. And it's always the influencers, regardless of how much authority they claim to have, or how many books or blogs they publish, how much content they spam the industry with. It's all performative to give you the illusion that they've done their research, but they're clearly not. They're clearly just skimming from other people and then embellishing every chance they get, because they know that every milliwatt per centimeter squared that they can fluff up and say is scientific, that's more money out of your pocket that they can get. So as always, we're just laying out the information for you from the top clinical researchers. Go listen to those full interviews, get a lot more context. You can go follow them, like, share, and subscribe. We're all about sharing information here. So that's my bit for today. Thanks for tuning in.